Hello and welcome to EBC TV. My name is James and today in this session I'm joined by the amazing Anna Jones from Bluecrest. Anna, how are you?
I'm very well, thank you, and thank you for having me.
Well, thank you for being on the programme. First and foremost, could you tell me, Anna, what you do professionally and who you work for?
Yep, so by background, I'm a paediatric nurse and a children's community nurse specialist. So been nursing 28 years now, and I joined Bluecrest just coming up to a year as head of clinical operations. So I kind of see my role in two parts. One is really bringing on new products and innovation to support preventative health, and one is really making sure all that we do is safe and of the best high quality.
Brilliant. So 20 years as a nurse.
28 years.
28 years as a nurse.
Yeah.
Well, can I just thank you for your service, because on the rare occasions I've been in the NHS, I think the nursing profession are fabulous. Probably not paid enough, or definitely not paid enough and not appreciated enough, but that isn't the case with me. So thank you for your service.
Well, thank you. And I've had the best time. It's a great career.
Brilliant. Okay, so today we're going to be talking about inflammation.
Mm-hmm.
It's a particular interest and specialism for us in this chat today, and a specialism of yours. So if I was asking you what is inflammation, what would your response to that be?
Yes, well, it's firstly such a good subject to talk about because it's the one thing where we can really make a difference. And what the research is showing at the moment is the huge link between inflammation and some of those chronic diseases, really serious conditions. So I'm really passionate to tell you about it. So aging is a common part of life, and we really take notice of what's going on the outside of our bodies, those symptoms, those aches and pains, but we really haven't got eyes and really trying to understand what's going on inside us. And what the research is showing is that as we age, chronic inflammation obviously increases, but what it's also showing is that chronic inflammation can increase the aging process. So if we look at inflammation, it's actually a really good thing. We do need inflammation, and that's acute inflammation. So when you think there's a threat to your body, so that could be through infection or an injury, what happens is you release lots of inflammatory cells that go to the area and do the fixing. So you
make it swell up a bit.
Yeah, you would know that's happening because you might have pain, might be red, sore, swollen. Once it's done the healing and done its work, those cells subside. Same if there's an infection, they go and kind of gobble up the infection and then subside.
Yeah.
So we need it. It saves our life. What's different is chronic inflammation, and that's our enemy.
Yeah.
So chronic inflammation, for some reason, they detect a problem. Those cells divide, go and do their thing, but they don't retreat and they stay laying there. And at first, it can be quite subtle. We don't know that chronic inflammation is going on, because if you have got symptoms, they're quite like other things that might be going on. And meanwhile, this is causing damage to our cells and tissues and putting us at real risk of developing some serious conditions, which I'll tell you about.
Okay, so I'm fascinated about this because I am getting old, and I do have part of my body gets inflamed like every 10 years because I get gout.
Okay.
And one particular toe just blows up, goes bright red, explodes in size, and actually gets so big that the nail just pops off, just says, I'm not playing anymore. But I take some anti-inflammatories to deal with that, and now I take an ongoing thing called allopurinol that stops that happening.
Okay.
So that's localized inflammation, and I'm aware of it. I can see it hurts and stuff. I didn't know that there was underlying inflammatory cell activity that could be long-term damaging for our bodies. Yeah. So this is absolutely fascinating and new news to me. Is this... Am I typical? Do people not really know about this?
I would say so. I mean, why I've chosen to talk about this today is because it is a really topical subject at the moment. You may well have heard of people talking about inflammaging or longevity. Yeah. But I think this is preventative health as a whole thing. We are not educated enough as a community, as individuals, to know about our bodies and to make those changes. Yeah. Because if we move to a preventative approach and make those changes, we are reducing so many of those risk factors and hopefully living a much longer and healthier life.
Well, I'm fascinated by what you said earlier, is that we can see on the outside what's going on, but we don't have eyes on the inside. And I'd never heard anyone really articulate it like that before, because that's obviously that makes loads of sense now. I can't see what's going on inside my body. Otherwise, if I could, I'd sort some stuff out that wasn't right.
Yep.
Okay. So the best thing we can do in terms of this then is to be mindful of the preventative measures we can take. Tell me a bit about some of those.
Yeah, so it always goes back to mainly those same things, but we seem to, don't we, as a community, as individuals struggle. So one of the main ways to reduce inflammatory levels is through eating a healthy diet, which we talk about so much, but so important. So we know there is foods that fuel inflammation. So they're your fried foods, your processed meats, and what that does when we're digesting them, that does create a level of inflammation. So it is going back to that healthy living, reducing those foods that we all know are bad for us. But also what's really shown is the research of eating those foods that we know are anti-inflammatory. So they are your leafy greens, they're your fruits, there's some of your things like your nuts. Omega, I'm sure you've heard about omega 3 and 6. That's very topical at the moment. And again, it's getting the balance. So omega 6 we really need. That comes from things like vegetable oil. But if we have too much, that can become inflammatory. So it's balancing that out with our omega 3s, which is what's coming from things like walnuts, flaxseed. So getting that balance right. And then the other bit of advice I'd say around diet is really giving consideration to gut microbiome. So we know maybe acute infections and taking antibiotics, other medications can really interrupt our gut microbiome. And you think then we've got inflammation. So that inflammation can sit there and give us some of those gastro symptoms of bloating, maybe abdominal pain. But also what we're showing is it's some of that stomach inflammation that can then go on to potentially stomach cancer. So diet's a big one.
So there's a causational link between inflammation and cancer.
Yep. So the links around the cancers, it seems to be the cancers that are that originate potentially from some inflammatory response. So I don't know if you've heard about H. pylori, which is a test we do at Blue Crest, which is looking for an infection in the stomach. If you've got that infection, it can lay quite dormant, but is generating inflammation. And those people that have been infected or have H. pylori infection can be more prone to going on to stomach cancer. If you think of some of the other viruses out there, so HPV, cervical cancer, some of the liver cancers are being traced to infections such as hepatitis. Think of some of the inflammatory bowel conditions, so your colitis, your inflammatory bowel disease, again, putting you at increased risk factor for bowel cancer. So you've got some of those really serious cancers, that the evidence is really coming through. It's still, the science is out on what parts of that are causing the cancer. Some think that the inflammation helps those cancer cells, divide and harbours the growth of them. So there's cancer, but then there's also the cardiovascular disease. So if we've got inflammation in our arteries, we're going to be more at risk of heart disease, stroke, heart attack risk.
So, pretty grim stuff. That's quite a long list of grim. That was, which, as an aging person, I need to be very mindful of. Going to go back to the first thing you said, which was processed foods and meats and frying them. Has the advent of air fryers made us healthier?
Oh, that's a good question. Actually, I wouldn't actually know that. I think it's still what you would put in that air fryer, I guess. It's still got the word fry in it, hasn't it? But people think, I get this sense that people who've got an air fryer think they're being slightly more virtuous and being slightly healthier. Well, you would be through not having a frying pan of oil, but it still comes down to what foods
what you put
in that fryer.
Okay, so if I'm putting sausages in an air fryer, they're not healthy.
No,
they're still not very healthy because they're processed. So, and there's a lot of talk about ultra high processed food. So is that also a risk factor for inflammation?
Definitely. Yeah, it's going back to those real basics of your pure foods, your fruits, your veggies, and your lean meat. So.
Okay, so and does hydration fit into this as well? Is hydration an important part of what, how we cope with inflammation?
Not so much. I mean, we would always say you want to be hydrated to maintain all your bodily function. So, I haven't read about huge links between hydration and inflammation, but other things that we drink. So obviously, your alcohol. You want to keep that in moderation. If you're looking for other ways to reduce inflammation, it's your exercise. And, we all live too much of a sedentary lifestyle, and it's making sure we do that cardiovascular exercise, but also the strength. Yeah, strength training is a big thing for
I'm fascinated on that point as well, because if you have some inflammation, it's going to make you maybe less mobile and less inclined to want to exercise. So how do you get around that sort of catch-22 scenario?
I think it's finding the exercise that works for you. It doesn't always have to be pounding on a treadmill. Yeah. It's just vigorous walking, thinking of some of the resistance training, thinking potentially water. Yeah. What exercise can you do in the water so that you're supporting some of those joints? But what we need to do somehow is get our heart rate going, and that resistance training.
Yeah, I heard the phrase once, motion is lotion. So rather than put lotion on yourself, just keep moving. Yeah. Okay, that's fascinating. I hadn't realised that a chat about inflammation would lead to exercise. Yeah. Okay, that is brilliant. So is there a main particular feature that you would say is what we should focus on as a way to reduce chronic inflammation?
I think it's just reiterating it is that healthy lifestyle. So it is your, like we've talked about, the diet, the exercise, but it's also other things. So looking after your own well-being, sleep, the amount of sleep, that your sleep hygiene, how good sleep are you getting? And of course, stress. Yeah. Stress is really linked to chronic inflammation. And some of those conditions we haven't talked about, I think the list got a bit too grim for you, but around brain health. Yeah. So think of those neurodegenerative conditions, so Alzheimer's, Parkinson's. Yeah. Really seeing, the link with inflammation, and exercise is really key to supporting our brain health long term. Not just the condition, the neurodegenerative, but also depression, anxiety. Yeah. So, we really need to get moving.
Physical exercise mainly, or even mental exercise? I hear my friends, my older group of friends, all saying, I'm doing more quizzes now to keep my brain going. Yes. That sort of thing as well.
All of that, and anything that supports, keeping your brain busy, but also that good just well-being, taking time, what works for you, whether it's mindfulness, yoga, we've all got something that will work and just help bring down some of those stress levels. Is really important. So I think it's living healthy, following some of that advice. But I think for people that are really interested about this, go out and take one of these profiles. We launched our profile about 2 months ago, and it's selling really well.
So I'm fascinated about that. So you said earlier that you could, Bluecrest can do a test for, I'm going to not remember the phrase you mentioned, the
inflammation H. pylori.
H. pylori. Yeah. Okay, so there's a test for that. What does that look like? How does that work?
Yeah. So we do a big range of additional tests on top of our health assessment. So it can be blood tests. We have stool tests, urine tests, lots of take-home kits, and we can identify whether through the blood test whether you've had. Well, whether you've got those antibodies, so whether and that could mean you've either had the infection or you've got the current infection, currently, of which we would advise you to go and have investigation and see whether that needs treating.
So for some employees are fortunate enough for their employer to pay for them to have a health screen. Yeah. But some other employers will offer it as an option through a flexible benefits portal. Yeah. So if I was to purchase a health check, would some of these things naturally be included in that?
It depends at what level. We've got entry level right up to our advanced screening, which has got a range of the cancer tests. But what we do in all of our basic screenings is your biochemistry, really looking into your blood health. And one of the main things we're really picking up is comorbidities around your blood pressure, your biometrics, your weight, and of course your cholesterol. And all of those put you at risk of cardiovascular disease. But we have got a lot of interest at the moment into the inflammatory profile. So I think there's a high chance that some of our corporate, partnerships will be looking to bring that profile into our basic assessments. And within that, we found some real key markers, particularly to measure inflammation specifically.
What would some of those key markers be?
Yeah, so one is called high sensitivity CRP. People listening to this may well have heard of CRP before. It's a blood test, and we normally use that when you're unwell in hospital, maybe with an acute infection, and it will show whether you've got those raised markers in your blood. You've got an acute infection normally. We do high sensitivity, which means we can pick up those inflammatory markers at a much lower level, e.g. we're picking up that chronic inflammation. So it's a simple blood test. Alongside the CRP, we measure ferritin, which is a protein that stores iron, but it's an acute phase reactant. So if there's infection in the body, you'll see your ferritin go up. So lots of people that might have things like rheumatoid arthritis, we would expect to see a raised ferritin. So they're the two main blood markers. And then we've put in the grip strength test. So I don't know if you've seen the hand.
I have done one of those myself.
And actually, there's so much value in that test, because what we're showing is those people with a lower grip strength are likely to have a higher inflammatory level. And conversely, those with good strength are likely to have lower inflammatory levels. So a grip strength is a great way to continually, if you want to track your health, doing that test every year is a great way to help track your potential longevity. So that's our profile at the moment, and it's really popular, and I really would recommend it.
Brilliant. I love that. This has been fascinating for me, because I've never had so much information about inflammation, which I knew I wasn't going to be able to say, but then I just got it right.
You've done it.
I got it right. So thank you so much for coming along and talking to us about this. If you were to give some final top tips to people to be on top of their inflammation health going forward, what would they be? Well,
definitely what I've said is that diet and exercise and managing your stress and overall well-being, and certainly not smoking, because obviously that is inflammatory. But I would say, and my ask to everybody is, please engage in preventative health. You can make such a difference. And with my career in paediatric palliative care, to be able to sit here now, life is good, we're lucky to have life. Let's look after ourselves and give us the best chance to live as long as life as we can, if we're fortunate to, and a healthier life.
Touch wood for that. I like that idea. Does giving you some EBC TV jelly beans in any way compromise your good health? Oh,
that's harsh doing that on TV. Of course I won't say no. I'll just eat them later maybe and share them.
Very good. So they are vegetarian.
Okay.
And I think this pot is probably less than 70 calories.
Okay.
So that's all right, isn't it? Everything in moderation.
In moderation. I'll share them and I'll go on a brisk walk later.
Okay.
How does that sound?
Very good. Thank you so much for being on the show, and please do take those with you.
Thank you very much.